Hello everyone and welcome to Mountain Lake Journal. I'm Tom Halleck. This week, the changing look of healthcare in the North Country. Alice Hyde Medical Center in Malone officially changed its name this week, joining the University of Vermont Health Network. The hospital is teaming up with hospitals in Plattsburgh, Elizabethtown, and the University of Vermont Medical Center in Burlington. It's been affiliated with Fletcher Allen and UVM for more than 20 years. But now patients will have access to even more services and specialists at UVM and CVPH.
This affiliation is about much more than a change in names. Being a part of UVM Health Network allows us to better accomplish our mission of helping people get and stay well.
Alice Hyde and CVPH have already been sharing a director of cardiology for 2 years, who says in many cases patients no longer have to travel to the bigger medical centers to see a specialist.
Do we have to travel? Do we have to go to Plattsburgh? Do we have to go to Burlington to get our care? And the answer is, as much as possible, we're now doing what we can right here in Malone.
All 5 of the hospitals will eventually streamline medical records and share more administrative and transportation services, which they say will cut costs. Also, in a few weeks, CVPH is becoming a teaching hospital. Its new family medicine center will welcome its first class of residents, 4 young doctors fresh out of medical school who will be training to become primary care physicians, something the area desperately needs.
The North Country is projected by 2020 to have a shortage of 100 primary care physicians. How do you address that? Well, this is one way.
Traditionally, 6 out of 10 family medicine residents will stay in the area where they trained. And to try to boost the odds, a half-dozen hospitals in northern New York and the UVM Health Network are teaming up to offer the residents jobs at their hospitals and up to $120,000 to help them pay off their student loan.
It's this type of support from other healthcare organizations that will help us alleviate the provider shortage and ensure our communities have adequate access to primary care for years to come.
It improved access to primary care, improves quality, and lowers the cost for the region.
And the Family Medicine Residency Program is also getting a huge financial boost, a $1 million grant from the Miner Foundation. William Miner built the Physicians Hospital in Plattsburgh a century ago.
William Miner would have loved this residence program because he believed that people learned not by sitting and listening, but by learning and doing. William Miner would be smiling today. Thank you very much.
And Stevens Mundy, President and CEO of CVPH, is here. Welcome. Nice to see you.
Good to see you again, Tom. Thanks for having me.
So this is a milestone for the hospital.
That's correct. Really excited about it.
Why is this so significant?
You know, it's really significant. We have other residents. We have medical students and residents who come over and get experience in one specialty or another, but they're based in Burlington, and they come over for a month and they experience our medical center in our community and take back the learnings that they get here. These 4 medical students that come over and become residents will live and work and train in this community for 3 years. And that's really, really exciting for us. And then you get to the second year and there's 4 more that come in, and the third year 4 more that come in, and you're at 12 and you have a robust residency. It's exciting for all of us.
The hope is that by having them trained to be family practitioners, that they may end up staying here and working in the area, and that's a real crisis here in this area. There's a real shortage.
It is. There's a crisis. There's a shortage, and if you look, we're all getting older, and our physicians are getting older, and they're looking. I've had discussions in the past couple of weeks with several that are, they're starting to think about that retirement platform and what they're going to do, and we're trying to say, okay, that's wonderful for you. We're trying to say, okay, what are we going to do to continue your practice? How do we fill your position? And we hope this residency is one of the answers to that.
Often studies show residents will stay in the area and set up shop and do their practice locally.
Yeah, and family medicine is really different from all other specialties with that. A general surgeon trains at a large academic medical center. Small percentages of them, 10, 15, 20%, stay where they train. Mostly they're thinking about that's their training location, then they'll go out and they'll find their practice. Within family medicine, they're more community minded when they come out. Over half of training programs are like ours. They're based in a community hospital, and so they tend to stay within that type of setting. It's a different experience.
Do you offer help with student loans to also try to get them to stay?
Whenever we recruit a physician to our community, we work with them on a variety of different things. But we said, we're really investing in this heavily, and let's do something innovative, creative, and we assembled the heads of all the hospitals in the region, and we're really thrilled with this. And each organization in our region has agreed to provide money each year for 3 years towards loan forgiveness for the residents that come out of our program. So someone starts here in June, and they know 3 years from now they can pick from any of the hospitals in our region, and they can stay in this region. So we've taken that pressure off of them, and really we hope open them up to exploring our community even more.
How many applicants did you have, by the way? How many students wanted to come here?
It was fascinating. We had 1,500 applications for 4 spots.
Wow.
From that 1,500, we invited a little over 100 to interview. Out of the 105 or something like that we invited, we interviewed 80. Then you get down to, of the 80, after you interview them and meet them, how many meet your criteria? And 60 of those 80 met our criteria. And then you rank them 1 through 60 and go through this computerized algorithm to match. And
one of your criteria, high on your list, you try to find doctors that are interested in rural medicine.
Interested in rural medicine, and not just say they're interested, but we look at their, there are all these clubs that you can join in medical school, Rural Medicine Club, Explorer Club. There are different things that you do as a medical student that will signal to your residency your interest in things. You could have an interest in, urban medicine and work in urban settings in your medical school career. And so we picked people who had not only said but demonstrated an interest in rural medicine. And
then Match Day is a big day where medical students across the country find out where they're going for their residencies. And so the 4 found out on March 18th that they'll be coming to CVPH. 3 of them are from Canada, and 1 is from Cleveland, but she goes to UVM across the lake.
That's correct. To experience it in the lobby of CVPH and have people from all over our community there to see who had picked us was a really, really unique, exciting experience.
And you're very happy with the first 4 students who are coming?
Oh, if you look at it, we got 4 from the top 12 out of 1,500. So, we've got our top 4 came out of less than 1%, the highest 1% of the applicants.
So these students are doctors. They have their medical degree.
That's correct.
Now they'll spend the next 3 years in training under other doctors to get their medical licenses.
And you get people, they go to pediatrics or they go into internal medicine or general surgery and internal medicine. It's the residency of your choice that determines your specialty once you go to medical school and get your MD degree.
The hospital teamed up with Fletcher Allen back in 2012 and has now become part of the University of Vermont Health Network. How well has it worked? As well as hoped?
It is exceeded our expectations in some areas. It's like anything else. It's been work in others. By and large, I'm overly rewarded with it. I think it's a great thing.
The goal, obviously, improving the quality of care and access for patients, eliminating duplication of services, and cutting down on costs. Have you accomplished most, if not all of that?
And many of those things, they're very difficult to do. Some of the things are easy. Supply costs. You're both purchasing the same thing from a national vendor. You go to them and say, okay, instead of being a tier 3, we're a tier 2 discount. And so automatically you just have savings by pooling your purchasing power. within clinical services, we made the very difficult decision to eliminate our cardiac surgery program, combine it in Burlington. Statistics will tell you that especially in programs like that, the more you do, the better you are. And so the premise for our patients is that the quality of the program in both places goes up. The corollary of that is we said we would work with the system to bring the patients from New York who are receiving care in Vermont back to New York, and we've done that. We're very excited about that. We've really established CVPH and therefore Plattsburgh for cardiology as the hub for Northern New York. We've got a cardiologist who works with us in Messina that delivers care there and refers patients to Plattsburgh. We've got a very close relationship with the cardiologist at Canton Potsdam, and they refer patients to us, so we're accomplishing that. But it's work really coordinating that and getting people together, making those decisions.
Were there any negatives that you found?
I think everybody, I did a learning session for our managers yesterday. I taught a class twice, and we asked them that, what have you given up? And you give up some level of autonomy. Before, if we wanted to buy a certain supply, we got a group together and we decided that. Now we got to be part of a bigger group. But we've gained so much more.
With healthcare costs, was this a necessity? Is it impossible for neighboring hospitals to compete against one another anymore?
I look at it and I don't imagine how any hospital like us, and really anywhere, can remain independent. You go to the Capital District. Every single hospital in the Capital District except one is in a system. They're either part of Albany Med or they're part of St. Peter's Health Partners. And even St. Peter's Health Partners is part of the larger Catholic system of Trinity. And you're seeing this going on all over the place. That's, I think, one of the reasons Alice Hyde is coming in. We have to work on the things that deliver care the best for our patients. And you've got to do that working together.
In what other ways is the network benefiting the region? Have you opened clinics in the area or offered more patient services in some of the outlying and underserved areas?
A number of different ways. If you take our services, and this is an example of how we've worked with the network to be the hub for Northern New York. So our cardiologists here in Plattsburgh provide cardiology services to Alice Hyde, to Adirondack in a limited fashion, to Elizabethtown, and to Moses Ludington and Ticonderoga. So they develop those relationships, and when they deliver a service, when a patient needs a service that they can't provide in those local communities, it's natural they come here. We've now taken oncology and done the same thing. So our oncologist here, our radiation oncologist, provide those services in Malone, Saranac Lake, Elizabethtown, and Ticonderoga. So we're doing that in a very planned, orderly fashion, working collaboratively.
You spoke out at a forum on the heroin crisis last fall, describing how your emergency room was seeing heroin addicts almost on a daily basis. A new Detox Center will now open in Clinton County, hopefully by this time next year, at the former youth center in Schuyler Falls. This will fill a huge gap in services?
Yeah, it really will. We see patients on an almost everyday basis, and it's an insidious disease, and it is a disease, and we have to look at it as that and treat them as that. And the stories around it, will just break your heart, as they did that night.
Is heroin right now the biggest health crisis that we're facing in the North Country?
I think it's one of the most, I wouldn't say it's the biggest, it's certainly one of the most unrecognized and undealt with. We've got good programs around cardiology and diabetes. We can do more, but we've recognized that and accepted that. I think that there's less of a social stigma on having cardiac disease than being a user of morphine or some type of drug like that. And we have to take that stigma away from it. We have to, get people to recognize that they have a problem and be willing to go into treatment. You can't involuntarily go put somebody in detox. It's a decision that every person has the right to make.
And so critical to have detox facilities closer. Right now, the closest is Potsdam, and for many people, that's just far enough that they don't make it there. And having a facility closer, many people hope will make a difference.
It's amazing, the stories. It's catching that person in the moment, and it's literally in the moment. We've got an arrangement with Champlain Valley Family Services we can call them and they'll bring somebody in to counsel somebody on opiates about going into detox. They catch them in that moment and get them to agree. And if we give that same person a card and say, call them tomorrow, the odds are, we've had people come in and arrest, they're dead. And we give them Narcan and we tell them they need to stay for 8 hours, and they say, nope, I'm good, I'm walking out of here.
You bring them back to life and they walk out.
And this person was dead 30 minutes ago, and they're walking out of here against medical advice. And
in many cases, we hear the stories where they're using again
that
within
night.
hours.
Yeah. I was touring one of our other hospitals recently and heard of a patient who went into cardiac arrest at home. A girlfriend brought him back. Didn't think he needed to come to the emergency room, and he used again, and he went into cardiac arrest a second time and then was brought to the emergency room. Those are the just incredible stories of the toll that this has taken on our communities.